So since it's 9 o'clock, why don't I get started? That way we can finish as close to on time as possible. So for those of you that are you here from various states other than California? Is anybody here from outside of California? Okay, so this information is going to apply to you as well. A lot of times, because we're talking about Medicare, people assume we're only talking about local Medicare. Medicare is national. So most of you may have seen the Medicare and You 2020 book. Have you ever looked at the back of the Medicare 2020 book? Our phone number is on the back. And people forget that there's an organization that is actually linked with CMS, which is the Center for Medicare and Medicaid. It is called SHIP, which stands for the State Health Insurance and Assistance Program. This program is national. It's available to anyone in the nation, except for the problem of they call the SHIP program different in every state, which makes it very confusing. So in California, we call it HICAP. HICAP stands for Health Insurance Counseling and Advocacy Program. It is a free service anywhere in the nation, but then it gets a little bit more confusing because within every county is a separate office. And you have to call the office in the county in which you reside, because why would we make Medicare easy? Let's make it more complicated, and let's add the factor that the policies that are available in this county, Orange County, are completely different than our neighboring county, which is San Diego County. And they may have similar names called, say, ABC Medicare Advantage Plan, but the San Diego County Medicare Advantage Plan has a little bit different requirements than the Orange County Medicare Advantage Plan. So this makes it very complicated. People assume if they're on Medicare, they can go to any doctor in the nation, which is sometimes true if you have something called Original Medicare. So just to kind of talk about our program, HICAP in California provides free services to anyone residing in California. And again, these are free services across the nation. Just look at the back of the Medicare and You book. You'll find the phone number for the office for you. Or stop by our booth, and I can give you the direct 800 number for that location. Second part is that we want to compare our plans every year. So what HICAP or SHIP does is we do plan and price comparisons. We make sure the plan that you are on now is not changing to a plan that you weren't expecting it to change to. And what are the big things they're going to change? Monthly premiums, if there is one, copays and deductibles, and your maximum out-of-pocket. Those are the three things we tend to look for. The thing we forget about is medication. Medications are able to change tiers at a company's choice. So one year the medication could be $4.25 a pack of medication. Next time it is $10 a pack. We don't have choice in that. But what we can do every year on Medicare is make changes to our plans. So who do you call? You call a SHIP or HICAP office. We do the plan and price comparisons for you. So I'm just going to use Orange County as an example. In Orange County, there are 30 prescription Part D plans. We would be asking the individual what medications they take, what's the frequency, what's the dosage, putting that into the system and comparing those 30 plans for them, giving them a few of those plans that are at the lowest cost. So they're making an educated decision without having to call every single plan and figuring out what's covered. We do the same thing with Medicare Advantage plans. So just to kind of give you a base of who we are and what we do. We're here all year long, not just during annual enrollment, but our most relevant time is during annual enrollment, because during that time, we are comparing all of the plans for a small number of individuals. So just to give you an understanding, there's 400,000 Medicare beneficiaries in Orange County. Last year, the Orange County office saw 1,200 Medicare beneficiaries. We provided them with a potential savings of $1.2 million. So imagine what we could do if we actually got up to a 10% review. I mean, 1,200 people out of 400,000 is barely even scratching the surface. So that means there's a lot of people out there that don't know about our services, are not comparing their plans annually. And it's not just to compare it to make sure you're in the best plan, it's also to compare it to have peace of mind that you're in the best plan. So a little bit about what's changing. First, the Medicare website has changed. So please make sure you only go to medicare.gov. There's a Medicare OC. There's all kinds of these companies that throw Medicare in their name for their website. They are not the official site, only medicare.gov. You can do quite a bit on here. But the most important thing I want to draw your attention to is up here. It's a little blurry, but it says mymedicare.gov. The reason for that is now my Medicare and my Social Security have accounts that you can make. So if you go to myssa.gov, you can find out what is your retirement age, how much money would you receive on retirement at certain years, what you might want to project and work towards versus what you may end up with if you didn't do anything. So that's a great location for myssa.gov. That's going to be your Social Security benefits. Alternatively, mymedicare.gov is the opportunity to see what you have for Medicare and to look to see any billing. Because, of course, where is a significant problem with Medicare? Fraud. So we can see almost in real time, not exactly, but almost in real time. You don't have to wait for the quarterly statements. You can see what's being billed to Medicare. The other thing to notice with the new site is a new a button down at the bottom says need a procedure, which allows you to do price comparisons for procedures. So this is the procedure website directly versus the link through My Medicare. This is also an app. So this app, I don't know what the widget is for iOS and Apple devices. When you download that app onto your phone, you now are able to search and see what Medicare covers because, of course, Medicare does not cover everything. But this is a little bit more user-friendly versus the website, which sometimes we can end up going down the rabbit hole in. There's so much information available. Okay. New Medicare cards. Everyone in the country should have a new Medicare card. If you do not have a new Medicare card, please stop by our table so we can tell you what you need to do. But the long and short of it is we need to have the new Medicare number to the medical providers before January 1 of 2020 or the next time you are at the doctor's after January 1, 2020 in order for them to have the new Medicare number. They will not be able to accept the old number. The old number was your Social Security number. We still want to treat this card like a credit card. Do not give it out to anyone. Okay? Keep it safe. You do not have to carry it in your pocket at all times. The other thing is if you know anyone with the old card, please have them destroy it. There is no nostalgic purpose of keeping that old card. It has their Social Security number on it, their signature, their full name, pretty much their date of birth when you look at when Part A and Part B start. So please destroy those old cards. If anybody needs help getting the new card, we are here to assist. Okay. So annual enrollment or open enrollment for Medicare runs from October 15th through December 7th. This is the only opportunity for Medicare beneficiaries to make a change to their Medicare plan. Now, I say only because that was the original rule. It has now changed. There's a second bite of the apple, but only for a very distinct few people, and we'll talk about that in just a moment. So general rule, October 15th through December 7th. If you try to make a change on December 8th, it will not happen. Anything that you do between October 15th and December 7th, it's the last thing you do will reign, and it will become effective January 1 of the new year. So let's take a look at the changes for 2020. Now, the changes have not been fully announced, so there are projected changes. So I'm going to tell you what some of the projections are. They are not going to be on the slides, just so you know, because they're not official and they could change. Unfortunately, we don't have any control over that. So the last projection was, first everybody starts with Part A. Part A is your hospital coverage. This means anytime you are admitted into into a hospital or into a skilled nursing facility, your Part A would attach if you are on original Medicare. Okay? At this time, you can also select to use your hospice care under Part A. Please do not buy a hospice plan. They are not necessary. You have hospice under Part A. Home health care is also available if you have been admitted into a hospital and released, but still require some home health services. You have those as prescribed by your doctor under your Part A. That is all going to be the same as it always has been. Same with Part B. Part B deals with your, keep hitting the button. Part B deals with your doctor's visits. So this is everything else that's not inpatient. Anything else medical that's not an inpatient facility, hospital or skilled nursing facility, will fall under Part B. Couple things I want you paying attention to. One, do not ever use the word physical exam when you are on Medicare. If you go to a doctor and say, I'd like a physical exam, you will be charged 100% for that exam. You have to use Medicare language. Medicare language is an annual wellness check. So we have some materials at the table in regards to what preventive services are available under Part B with the terminology you want to use. So there is a correct language to speak under Medicare. And we want people not to assume that everything is covered because it is not. The second thing I want to pay attention to is labs. So our doctors, with our best intentions in mind, provide us with a lab slip to tell us to go down to the lab and submit it for labs to be done. So we head on down, we hand over that lab slip. Unfortunately, not all labs are covered by Medicare. Our doctor does not have time to understand this. Probably our nurses don't even have time to understand this. We're hoping the billing office has time to understand this, but they're usually not available when we're at the doctor's office. So what happens is we go down to the lab, we hand them the slip. They're going to do one of two things. They're either going to take that lab slip and just say, sit down, we'll call you in a minute. No issue there as far as we can tell. Issue comes in when they send us back with some forms to sign. One of those forms is probably going to be a release. And basically what you're signing away is saying any labs here that are not medically necessary or covered by Medicare are your responsibility to pay. You need to know this up front. The lab tech is not responsible for educating you on what lab services are or are not covered. They're not responsible for educating you on what your bill is going to be once you leave the lab. But you do have a right to say, no, I am not going to sign this form. Whatever labs are not covered by Medicare, please let me know. I'll talk to my doctor to see if they are medically necessary, because if they're medically necessary, they need to be recoded, and then they would be covered by Medicare, hopefully. Okay, but they have to be medically necessary if they're not already covered by Medicare. So those are a couple terms we want to pay attention to. Most of us have free Part A. This means that we have worked in some sort of field in which we are paying into FICA or Medicare for 40 quarters. That's approximately 10 years, any time in our life. We can go to that ssa.gov and see if we have free Part A. If you do not have free Part A, we end up paying up to $437 per month per person. These amounts for payment may be going up, but we do not have a projection for those. So hopefully you have free Part A. And that's for you or your spouse provides the free Part A. You just have to have those 40 quarters. Second, we have Part B. Now here's where one change is going to occur. Part B, right now, we pay $135.50 per month per person. The projection is it going up to about $144.60 per person. Unfortunately, we have a COLA this year for Social Security. COLA is the cost of living adjustment. I think a lot of that an increase in our Social Security is going to end up going to Medicare. In addition, if you make more money than a certain bracket, you pay more for Part B. It's called an IRMA, an income-related monthly adjustment amount. This is also all going up in two ways. So this is what it looks like. Right now for 2019, if you make more than $85,000 a year as an individual or more than $170,000 as a couple, You just pay the base, $135.50. For 2020, they're looking at moving up it to $87,000 per couple, and I believe it was like $174,000, $173,000 for a couple. Now paying that projected $144.60. Each of these categories will then also increase. This top one is looking at increasing about $12 for the second one, all the way down to about $50 per person. So if you're making over $500,000 a year and you're paying over $500 a month for your Part B premium. So what this means is Medicare goes to Social Security. Social Security is where we sign up for Medicare. They look at your income taxes, your your adjusted gross taxes from 2 years ago. They do that to determine these amounts. So say I am now no longer working. I retired this year, but 2 years ago I made $107,000 a year. But now as a retiree, I'm only making $60,000 a year. What I'm going to do is I'm going to tell Social Security I have made a change in my life. I've had a life-changing event today. I did not or am not going to be making what I made 2 years ago, and I would fill out this form. It's the SSA 44. So if you are on Medicare and you receive something from Social Security saying that you have to pay an IRMA, this is the form you want to look at to see if there's been a change in income for the individual in which we can lower that Part B premium, because that is a monthly premium that you're paying. In addition, late enrollees do pay a 10% per year delinquency fee, and that is either paid for twice the number of years that they were late. So if somebody is 4 years late from enrolling in Medicare, that's 10% per year, so that's 40%, and they would pay that delinquency fee for 8 years. Now, if they're paying nothing for Part A, 40% times 0 is still 0, so that's okay. It's the Part B. Same 40%, they now will pay that for whatever they are owing for their Part B premium for the rest of their life. So as the Part B premium goes up, so does that delinquency amount, that penalty. In addition, if you are on original Medicare, you have some coinsurances, some copays and deductibles. So coinsurance for Part A, this year, $1,364 for the first night that an individual is in the hospital. This is also looking at going up for 2020 to about $1,440. So if they only have Part A and Part B and they go into the hospital for one night, that's $1,440 out of their pocket instantly. So we really want to look at our options. We have options on Medicare that negate this deductible, that help absorb it, and I'll explain that in a moment. The other thing to think about is spell of illness. Spell of illness means it has to be related to the first illness I went into the hospital for. So if I fall, I break my hip, I go into the hospital, I have surgery, I'm doing great, I paid my original coinsurance, I go home, I catch pneumonia, totally unrelated to my hip injury. I go back into the hospital, I pay a new $1,440. Every time this happens, you are paying that coinsurance of $1,440 or $1,000. This year, it's the $1,364. So if they're not related, this can be very expensive just having Part A and Part B. In addition, on Part B, you pay that monthly premium. This year is the $135.50. But in addition, you pay $185 annually as a deductible. This is looking at going up to $199. In addition, Medicare pays 80% and you pay 20%. So imagine what those costs could be just going into the hospital one time, because not all services are under the hospital. Some of those are doctor's services. And we haven't even talked about drugs yet. So once you decide you've enrolled in Medicare, you have Part A and Part B, now we have to look at the Medicare Part D plans. Those are our prescription plans. Now these are optional, But optional really isn't an option. Okay? You have to get one, because if you don't, I apologize, I keep hitting the button with my finger. If you don't review and receive a Part D plan, there's a penalty here as well. So the first thing is that once you enroll in Part A or Part B, you only have about 2 months, 63 days, to enroll in a Part D. If you do not enroll in a Part D, you do not get to just enroll whenever you decide you need medication. You have to wait till you have the general enrollment period. General enrollment is January 1 through March 31st. Then the plan would start in July 1. So this is very important that you enroll in a timely fashion. In Orange County, you have 30 Part D plans to look at. Every county across the nation has a different number, so you really want to talk to your SHIP office, or in California, your HICAP office, to find out how many Part D plans are available to you in your county. We would review those plans, and those plans in Orange County range from about, well, actually, excuse me, these are mostly national, but they range from about $13 to $118 this year. The deductible for these are about $0 to $415 this year. They're looking at the deductible going up to $465 annually. Now, the one thing I'm not going to talk about here today, but I'll just give you a brief overview, is you may hear something called the donut hole. The donut hole is you having to pay so much for your prescriptions. The donut hole works a little bit like this. You pay just under $1,000 in order to get to the edge of the donut, the inside of the circle. From that point until you cross that threshold, you're paying about another $1,500. So out of total pocket, we're looking at about $2,500 total per year that somebody that is on very expensive medications would have to pay. The remaining amounts that you'll hear from the donut hole are dealing with what Medicare is paying and what the pharmaceutical company is paying into these numbers. So when you're hearing the donut hole, there's going to be a $6,000 threshold and a $9,000 threshold. Do not worry about those numbers. As an individual, the most they would be paying out of pocket is about $2,500. Okay? That's all you really need to know about the donut hole in this short period of time. That could be a whole 2-hour discussion if we let it happen. But I want you to understand, if you are on original Medicare and you have a Part D plan, please see a SHIP office. Review that for free. You can call us once, you can call us 100 times. We will review that for free. What we're going to ask you is, what pharmacy do you want your medication from? What medications do you take? What is the frequency in which the doctor prescribed it, as well as the dosage? We're not going to worry. A lot of times we hear about, well, this is how I take it. I don't want to know how you take it. I want to know what the doctor had told you to do. We're going to look at all of those plans that are available to you to see which one will cover the cost the most. So we're looking at maximizing your coverage, minimizing your cost. That is our only objective. We do not sign you up for plans. We do not sell plans. We are not participating in any insurance agency or business. We're just informational and advocacy for Medicare beneficiaries. If you do not sign up in time, there is a penalty. It's a 1% penalty for each month you were delinquent. So if it was $33.19 was the national average, you are charged 33 cents per month. If you were delinquent for 4 months and you bought a $12, $13 plan, you now have an additional $15 added to that fee every month for the rest of your life. In addition, if you make more money, you are also impacted by an IRMA for Part D as well. So this in the red is the amount that is on top of whichever plan you buy. We haven't even started talking about your prescription costs here. This is just your monthly premium. In addition, you can buy a MEDICARE. Now, the thing that I want you to know about the MEDICARE, we know that there is a Plan C and Plan F. Plan C and Plan F, you are hearing they're going away. That is not accurate. They are not going anywhere. Anybody who is eligible for Medicare, prior to January 1, 2020, whether they purchased a Medigap in the past or not, is eligible for both a Plan C and a Plan F anytime in the future. The difference being is when you first become eligible for Medicare, you have 6 months in order to enroll in a Medigap. You have 6 months with something called guaranteed issue, meaning you are guaranteed to be issued a Medigap at the lowest cost without any medical underwriting. No pre-existing condition questions. It doesn't matter what your health status is, you are eligible for a Medigap. Why do I want a Medigap? Is because I am going to doctors often, and I want to make sure my Part A and Part B coinsurance and copays and deductibles are covered. So this is kind of like car insurance. They give you an annual premium. You may pay it over a monthly period. So $1,200 a year, you break that down by 12, you're paying $100 a month for your Medigap. They're paying that hospital coinsurance that we talked about. They're paying the Part B deductible. They're paying the 20%. So 20%, if you're going into the hospital or the doctors a lot, could be very excessive, where $100 a month is very reasonable. Okay? So that is original Medicare. Why would I want original Medicare? Because I have the right to go to any doctor in the nation that accepts Medicare. Anywhere, no questions asked. As long as they accept Medicare, you can go to the doctors under original Medicare. That's Part A, Part B, you have a prescription plan, and hopefully you have a Medigap so you're not paying out of pocket. A lot of these Medigaps are offering extras. So traditionally, eyes, ears, teeth, and feet are not covered by Medicare. No routine eye care, no hearing aids, no ear checkups. But what if I'm diagnosed with cataracts? Cataracts would be covered because, again, that terminology, medically necessary. And now you have coverage. So we want to know the terminology medically necessary because what's not covered by Medicare generally could be covered when it becomes medically necessary. So I have diabetes and I need orthopedic shoes, medically necessary. Or I've met people that have diabetes that have eye concerns, medically necessary. They can get the injections for their eyes because it is covered by Medicare, because it is medically necessary. So really watching that terminology, medically necessary. So these extras may be a small incentive to purchase their plan. The thing you need to understand is, of these 10 Medigap plans, companies sell these plans individually. So if I buy a Plan F, there may be 30 Plan Fs to choose from. Every company is offering me the same services. Extras may be a little different, but for totally different prices. So one company may be $1,500 a year, another company may be $3,000 a year with no explanation as to the difference in price. So we need to price these every year if we have a Medigap. We price them 30 days after our birthday every year. So open enrollment, you can change Part D or Medicare Advantage, which we're going to get to next. Medigap, you change 30 days after your birthday. Okay? Plan C and Plan F, again, are not going away for anyone who was eligible before January 1, 2020. They can still buy them. They just may have medical underwriting. Okay? So just to recap. Now the difference between these two, so a Plan F and a Plan G, the only difference is they will not be paying that deductible. That $185, the projection for 2020 is about $199. The difference between Plan C and Plan D, same thing, the deductible. The other thing to notice on the Medigaps, a little bit of foreign travel. Not much, but there is a little bit of foreign travel because Medicare does not cover foreign travel. So 80% of foreign travel could be covered under here without having to buy an additional plan. But again, we always suggest if you're going to travel internationally, buy a travel plan, a foreign travel plan, because it's reimbursement here. It may not be upfront. The other thing is if I'm out of the country on Medicare, I fall, I hit my head, I pass out, I'm in the hospital, guess what word's coming up again? medically necessary, then I will be covered again. But if I just have a tickle in my throat, want to see a doctor, not going to be covered if I'm traveling internationally. So this is, original Medicare. The other thing to point out is there is no long-term care in Medicare. Do not confuse that with Medi-Cal or Medicaid long-term care. There is a long-term care under Medicaid. If you're in California, we refer to that as Medi-Cal. Okay? But under Medicare, there is no long-term care. Medi-Cal or Medicaid is income and asset-based. Medicare is age or illness-based. So the alternative is a Part C plan. This Part C is our Medicare Advantage plans. Now in Orange County, there are going to be over 52 Medicare Advantage plans available to Medicare beneficiaries next year. Every county is incredibly different, and you are in a network. So even if you're with an organization, say Kaiser or Blue Cross or Aetna or SCAN, it does not mean you can go to any doctor that takes that plan, that insurance company. It only means you can go to doctors that take that plan. In Orange County are Orange County plans. So you cannot go to San Diego to see a doctor that takes a SCAN plan, or Riverside or San Bernardino. You cannot go to a doctor in Florida or Vegas. You have to stay within your network. So these plans are a little less expensive because most of them have a 0 monthly premium. But you will still have co-insurances and co-pays, and you will still have maximum out-of-pocket. They are also offering those extras. So maybe a gym membership, maybe transportation to and from a doctor's office, maybe meals after you were admitted into the hospital. So most of the HICAP or SHIP offices do plan comparisons for these to see what those extras are and what benefit does it mean going with one company or another. But again, what is the office going to do with you as a counseling session? We're going to ask you, what doctors do you want to see? What hospitals do you want to go to? We're going to look at, in Orange County, all 52 Medicare Advantage plans and narrow it down to the plans that meet your individual wants and needs. Doctor, hospital, and medication. Then we're going to look at maximum out-of-pocket. The Orange County plans, maximum out-of-pocket, lowest, $1,000. Highest, $10,000. So we don't want you just picking a plan because it gives me a trip to and from the doctor's office if that maximum out-of-pocket is $10,000. That's not reasonable. So we will help you with that understanding and comparison. We actually do a side-by-side chart of all the plans available. So here's a side-by-side comparison of the two tracks that you can go. Original Medicare, whether it's Part A and B, you're paying the same regardless of the track you go on. Part D is only for Original Medicare, but you pay the IRMA. If you're susceptible to an IRMA, you'll pay it on either side. That's that income-related monthly adjustment amount. You make more than a certain amount, you pay more. Okay? So you're going to pay the same. The difference being is most of the Part D is included in a Medicare Advantage plan. You're not going to pay extra for that. This is not including your copays, your deductibles, or your cost of prescription medication. In addition, you're going to have the MEDICARE as low as about $150 a month, highest about $350 a month, $350 a month. You cannot buy a MEDICARE when you're on a Medicare Advantage plan. But you do have to watch for those copays, the co-insurances, the deductibles, the maximum out-of-pocket. So we can help anyone within the United States review these plans, understand what's happening with the plan, how is it changing, what can they expect in the future. And they should review these plans every single year. Your Part D plan and your Medicare Advantage plan, you can review every year, October 15th through December 7th. A couple additional options, if you individually or somebody you know or somebody you're working with is not eligible for Medicaid, Medi-Cal in California. There are other services available. They need to talk to their HICAP office or their SHIP office. Why? Because in California, we can have a Medicare Savings Plan, MSP. And these are mostly national. I don't know if the rates are different throughout the United States. I just know the rates here in California for sure. And we do have some literature at the desk if you're interested. This is an income and asset-based assistance to help pay for Part A and Part B. And we can see if you're eligible based on those numbers. But whenever you're looking at eligibility for income and asset, do not think about, I own a home, I must not be eligible. I own a car, I'm not eligible. Not the case. Okay? So a home and one car could negate you from nothing. You may still be eligible. So don't get caught up in, I own something, I may not be eligible. What they're looking at is, what do you have in a savings account? What do you get in pensions or other sort of income? Okay. LIS is extra help with medications. We also all know what our local assistance on medications are. And there are some medications out there that are insanely expensive. But you may not have to pay them. At least talk to us before you kind of, lose hope. Give us a call. LIS helps pay both the Part D premium as well as medication costs. You may be eligible to get assistance through Linet or some other service that helps pay for medications. And we do have resources that we can provide you. So we talked about open enrollment. Now I'm showing you this slide one more time because this is where that exception is. Now everything I've talked about is all a surface layer of Medicare. And if you've ever read one of those build your own mystery books, where at the end of a page you can decide, if little Johnny's going to go to the beach or the mountains, and you can read that book 4 or 5 different times and have a different story several times reading that same book, that is Medicare. So everything I've told you, there are probably 30 exceptions to every general rule I've given you. So when you leave here today, it's not to know Medicare, it's not to fully understand Medicare, it's really to know you have a resource to call. But every person has one piece of the story that changes and the whole story changes. So please make sure you make people aware of that it's not a one-size-fits-all. Because remember how I said you can only make changes October 15th through December 7th. Yeah, not true either. Because, I'm going to ignore that. Because if you are on a Medicare Advantage plan starting January 1, you get a second bite of the apple. You actually can make another change at that time. And you can make it to either another Medicare Advantage plan with the company, go to a totally different company, or leave the Medicare Advantage plan completely and go to original Medicare. Okay? So if you find out something is wrong with the Medicare Advantage plan, whatever it is, after January 1, you are not stuck for the year. You can get out between January 1 and March 31st, and you can make a change. You only can make one change. What it used to be is you only were allowed to disenroll. You didn't have any other options other than going back to original Medicare. Not the case here. Okay, so slight change. This is mostly about the Council on Aging, which is the nonprofit that we are housed under. So I highly recommend everyone in this room find the nonprofit that deals with elderly in your community, because it's different for every county. In Orange County, it's called the Council on Aging. We also have the Office of Aging, so that gets a little confusing. But we have services available, and we want to make sure people know what services they are available to or entitled to or can get assistance with. So do not be afraid to reach out to those nonprofits that are here to help. We try to work together. We try to know about each other so we can refer. We don't always do a good job of it, but we try. There's so many out there trying to do good. But those are the main changes that you're going to see for Medicare for next year. Do I have any questions? No? Okay. Well, oh yes, go ahead. Oh, thank you. I don't know if it is or not. They've been recording. He told me I couldn't move from here, so I'm hoping, yes, it could be. Thank you, first of all, and thank you everybody for being here, because this is not a very sexy topic. It's a very, really, do I want to listen to Medicare? If they live in Orange County, actually, I'm going to rephrase that. If they live anywhere in the nation, the first task I always ask, please contact your SHIP office. Because for me, what I do is I go around and I speak about Medicare to Orange County. So I'm at the hospitals, I'm at businesses, I'm at senior centers, I'm anywhere somebody will listen to me, doing the same kind of conversation. I do believe that all the SHIP offices do this. I don't know what capacity they do it in or if it's as entertaining, but there is access to it. But if you're in California, especially if you're in Orange County, we do have information, and I do this at least twice a month at our office. So stop by our desk and I can give you some information about our presentation at the Orange County office. No. That's a great question, and I didn't even know they did that. Shame on them. Okay, so on the back of the Medicare and You book is always our phone number to the office that is general for you. The issue with this is it is an 800 number. It sends you into the SHIP hotline that then directs you to the office that is affiliated with your area code that you're calling from. The SHIP here is SHIP. The acronym is actually State Health Insurance and Assistance Program. They left out the A, and I don't know why, but they did. So although we are SHIP, State Health Insurance and Assistance Program, we are not the same SHIP for that. And if you try to Google or search just SHIP, you will not find this. But if you put in SHIP Medicare, or we also have websites we can direct you to get to your direct office. But like I said, if you're from out of state or out of county, I can give you the direct number at the table. Yeah, absolutely. And it's not a silly statement. It's absolutely a valid statement, definitely. There are no silly questions in Medicare. This is a confusing topic. And we didn't even get into it. The one thing, and I know we're over on time, but do remember for individuals who are eligible for Medicare, if they are under 65 years old, they have to be collecting SSDI, Social Security Disability Insurance benefits, for 24 months. On the 25th month, they become eligible. I highly recommend coming by our table and going right next door to the Social Security office. Jeff is amazing. He will provide you with a wealth of information about how individuals can get both SSI and SSDI benefits. Now, SSI, Social Security Insurance benefits, are not the same thing as SSDI. So they do have to have SSDI benefits. The other reason somebody can get Medicare, which we really didn't get into today, is if they are diagnosed with ALS, Lou Gehrig's disease, which if you're diagnosed with epilepsy and then Lou Gehrig's on top of that, I hope we have a good support system, because that's really tough. As well as ESRD, which is end-stage renal disease, which could be something that happens to some because of kidney failure. So we want to make sure people know that either those ALS, Lou Gehrig's, same thing, or ESRD, end-stage renal disease, that's the kidney failure, and you're under 65, you are automatically eligible for Medicare. Yes, sir.
Michelle, you touched on earlier the extra help LIS patients.
Yes.
Do you have any idea, is this something that's a lot of people are eligible for, say, in Orange County of the 400,000, or do you know what percentage roughly?
I do not know what percentage. Because Orange County is a very high income location, a lot of them would not be, but people are eligible and they think, oh, I'm not eligible for Medi-Cal, I must not be eligible for any other assistance. But I do have those numbers on some materials at our desk, at our table. And we're against the far back wall behind the brain. So we're back there. Yes, anything else? Well, thank you so much for listening and staying, and I hope you got something, you learned something new out of all of this. And please stop by, say hello, tell friends and family they can get help, please. Thank you.